Okay, we're clicking start. All right. Good afternoon. Thank you, everyone, for joining us. My name is Emily Polet-Monterosso. I am the Executive Director of the National Kidney Donation Organization, or the NKDO. This is our seventh Engage session in the 2025-26 series, where we aim to educate, engage, and empower attendants on a broad range of living kidney donation topics. Through this series, we hope to raise awareness, build community involvement, and increase the number of living donations to help end the kidney crisis. We're grateful for the privilege of hosting these educational sessions thanks to a generous grant from Sanofi, a global leader in immunology. Today, we're celebrating National Minority Donor Awareness Month with a conversation about issues unique to people of color in the kidney transplant and donation space. And we'll hear from three highly esteemed industry leaders who engage with communities which are marginalized as a routine part of their advocacy work. So we hope that you'll feel better informed about unique issues facing donors and recipients, and generally communities of color impacted by kidney disease after this session. Couple of housekeeping notes. Please keep your microphone muted and your camera off if you're not speaking. You're welcome to use the Q&A box to ask questions. And we will get to those after the session. A little bit more information about NKDO. NKDO was founded in 2016 by non-directed donor Ned Brooks. It is the largest member-based donor advocacy organization in the country. Our mission is to support living kidney donors and those who wish to learn more about the living donation process through mentoring, education, community building, and advocacy initiatives. We hope that this webinar will help to educate people considering living donation and empower them with hope, inspiration, and useful tools. Now I'd like to introduce our panelists. First, we have Trish Phillips. She resides in Fort Lauderdale, Florida. She decided to donate her spare kidney in 2016 to her best friend, Kimberly, of 20 plus years after witnessing her battle with dialysis for over 2 years. Since her donation, she's been on a mission to inform others about organ donation, especially in multicultural communities. She works to debunk myths and change the narrative in organ transplantation for minorities. She's the founder and executive director of the Multicultural Miracle Donor Foundation, or MMDF. And she's the co-author of the book Because of Organ Donation, and she hosts a weekly radio show to bring awareness to kidney health and other health topics. So Trish, we'd like to thank you so much for being with us today.
Thank you for having me. It's an honor.
Of course. Next, I'd like to welcome Wilson Dew, known as Renal Warrior. He is a kidney transplant recipient, patient advocate, and founder of the MissionHQ, a community-driven fitness facility in Alameda, California. He's also a brand new father, so congratulations to him.
Thank you.
After being diagnosed with kidney disease in 2016, Wilson spent 5.5 years on dialysis while refusing to let his condition define him, completing triathlons, cycling hundreds of miles, and competing in national events, all while tethered to treatment. In March of 2022, he received a life-saving kidney transplant that transformed his journey into a mission to inspire and empower others. Today, through the MissionHQ, his advocacy with the National Kidney Registry, and his mentorship programs for dialysis and transplant patients, Wilson works to break barriers, spread awareness, and bring hope to underserved communities. Welcome, Wilson. We're very happy to have you on the panel.
Thank you, Emily. Always good to see you.
And Dan Holmes is a U.S. Navy Special Operations veteran and kidney disease survivor who turned his personal battle with membranous nephropathy into a national advocacy mission. As the founder of the Enlisted Kidney Foundation, Dan draws on his military training and lived experience to empower kidney patients, influence healthcare policy, and educate medical professionals. A dynamic public speaker, he has delivered keynote addresses at national summits, spoken on Capitol Hill, and served on research panels alongside leading scientists and pharmaceutical leaders. His mission is clear: to ensure every kidney warrior feels seen, heard, and supported in their fight. Welcome, Dan. We're very glad that you're with us today.
Thank you so much for having me. We're excited to be here.
Of course. So to share a bit of context to everybody as we begin, those of you who are on this call are likely familiar with the shortage of organs available for transplant in the United States. Most recent figures from the OPTN indicate that there are approximately 100,000 people on the wait list for life-saving kidney transplant. But according to the U.S. Census Bureau, approximately 60% of the U.S. population is white, and the remaining 40% are people of color. But of the 336,000 people waiting on a kidney transplant. OPTN data indicates that only 34% of the people on the list are white. This means that despite making up a substantially smaller part of the US population, people of color make up more than 65% of the kidney transplant wait list. SRTR analysis shows significantly lower rates of preemptive kidney placement being placed being listed before needing dialysis for Black and Hispanic patients. So it looks like 17.5% or 18.5% respectively, compared to white candidates, which are placed at 39.4%, according to the National Institutes of Health. According to the SRTR 2023 annual data report for kidneys, disparities are exceptionally wide in living donor kidney transplantation, where systemic barriers, neighborhood segregation, and public insurance status heavily depress access for non-white patients. So, with all of that context in mind, I'd love to hop in and pose our first question for discussion with our panelists. First things first, I would love to hear from each of you. Can you share just a little bit about your personal connection with kidney disease, donation, and transplant? Please feel free to hop in, whoever would like to start.
Sure. Wilson Dew over here. I was diagnosed, as you said, 2016. Didn't know I had kidney failure or didn't know I had any kidney issues. I knew I was very unhealthy, and it wasn't until I went into the ER for unrelated issue, then was diagnosed right then and there with stage 5 end stage renal disease. And right then and there, life turned upside down. And through that whole time, while on dialysis, I was strong enough to actually advocate for myself. I was a big voice um, for myself, asking doctors questions and just trying to take control over it. And I see a lot of my fellow chairmates out here where I'm at who didn't have that capability. And so I was very fortunate in that respect. And, post-transplant, I learned so much about the donation process, and that included meeting you, Emily, and the whole group of donors out there. And so one of the missions I have right now is to try to bridge that gap between the patients as well as the donors, especially in our underserved communities. And so, yeah, that's in a nutshell what my story is.
Oh my God, Wilson, I love that. I totally love that. Trish, go ahead and share your story. I didn't want to talk over you.
It's okay. I think we started at the same time, but as most of you already know, I'm Trish Phillips, a directed kidney donor. I donated directly to Kimberly, who's a closer friend of mine. And at the time, almost 10 years ago, I myself come from a path of medical mistrust, and I was not educated in the world of organ transplantation. So Kimberly didn't ask me. I volunteered and I did my research and I found out I was a direct match. She and I are both doing well. And after I donated, I noticed there was a lack of diversity for people of color as transplant donors for kidneys or livers. So I decided to start MMDF not only to educate and inform and assist in the process of living kidney donation. I saw there was a need to change how the medical mistrust is seen, debunk myths. So I set out on a mission to make a difference. And MMDF is now coming up on its 5th year, along with my 10th year as a living kidney donor.
Amazing.
That's awesome. That's awesome. Well, my name is Dan Holmes. I am the founder of the Enlisted Kidney Foundation, and my connection to kidney disease is rare. I was diagnosed in 2020 with a rare kidney disease called membranous nephropathy. It's a protein spilling kidney disease in the same family of nephrotic syndrome as like FSGS or IgAN or some of the others. I didn't know any of this in 2020. I didn't know anything about my kidneys in 2020. I blew up like the Michelin tire man almost overnight. I walk around every day about 215, 220, and I woke up like 300 pounds. I didn't know what was going on. Ultimately, I got to the medical professionals. Now, this is where my journey kind of hits a fork in the road with a lot of other people who have similar journeys. I'm a VA patient. I am a former U.S. Navy Special Operations Search and Rescue operator, and I contracted my kidney disease from toxic chemical exposure. And we were able to directly link that with our pathologists and our medical professionals. So that really sent me down a different path of investigation, wanting to know what was causing this disease when all of my medical professionals and all of my medical teams were throwing their hands up and didn't really understand what was going on with me. I was given 12 months to live in 2020. I said goodbye to my family several times. I even picked out my grave site at Arlington Cemetery. Now, in my experience in the military, we go and live by a motto, so others may live. That's what we did in the search and rescue. That's what I did in my own world. That's the only thing I really understood in the face of adversity. So I had to first save my own life. I had to go against what everybody else was telling me. I had to do my own research and quickly found out I needed to be one of the smartest people in the room. That led me down a path of research. If I've got 12 months to live, I'm going to spend the next 12 months figuring this thing out before, you know. So that led me to advocacy. I started learning about this journey, learning how rare these diseases can be, how they can get contracted, what parts of the body are affected by some of these diseases. So I really started becoming interested in CKD, kidney disease in general, learning what the kidneys do to the body, how important they are for our filtration and our blood systems and all of the things. And what I couldn't find after looking after so many different organizations. Now, with me being in the military and having this national story, it got a lot of attention. So I did do a lot of traveling around and sharing my story on the national stage, which is amazing. And it led to a lot of really good relationships, some with we all have here. But one thing I really couldn't find that I really needed was the help navigating my own VA healthcare system. And that just didn't exist in this space. So in 2020, I decided to launch the foundation to support these bridges called the Enlisted Kidney Foundation. And EKF has been super successful thus far. We're like a year and a half in. We are making record-breaking ground movements into the CKD space. We are reaching patients where they are. We have an award-winning mentorship program where we don't only just preach the gospel of CKD, right? The preventions, the signs, the symptoms, but we talk about the people who are on the dialysis, right? Wilson, the people that were sitting in that chair for 5.5 years, you know? We want to pay attention to those people that are reaching, that are trying to find support. And that's why we're doing our grassroots efforts in campaigning, trying to find people where they are and reach patients where they are. So that's a little bit about our mission and kind of where we're doing. Aside of that, and why this is a special, special month for me in minorities is because RKD has recently been linked to APOL1 mediated kidney disease, which is a genetic marker. And that genetic marker is most commonly found in Black and Brown people with African and Spanish heritage. So through the efforts of research and all these different things, it just jumped out at me that our Black and Brown communities are so much more affected by CKD and kidney disease. And even a smaller group of people are veterans, our Black and Brown veterans who are exposed more often to toxic chemicals and all of those things. Trying to get the words through the VA system is really what we specialize in. So thanks for having me.
Absolutely. Thanks for all of that insight into you guys' individual connections. I'd love to hear now from you guys to maybe just talk a little bit about, based on your personal experience or your experiences with individuals that you served in your communities with your organizations, just the challenges that are facing communities and individuals of color when they first receive a kidney disease diagnosis.
I have
Well,
That's a
one.
huge. Oh, go ahead.
Okay, maybe
Go
if
ahead,
you two
Trish.
want to start with you, Trish, or start with you, Wilson.
Doesn't matter. Go. All
Okay,
fun.
I think what I run into the most when I'm out speaking, that once first they're hesitant on understanding that they need to become healthy to get on the wait list and to get on more than one wait list. And not only that, I have gotten a lot of resistance of why should we get a kidney transplant? Because they're only going to last 8 years. They're not properly educated or informed that you can live even with a deceased kidney for over 8 years. And for me to explain that, I have to always give them an example. Um, as many of you know of Mr. Georgie Franklin III, who just passed away. His memorial is actually today, right now. And I have to use him as an example because he lived for 50 years on the single kidney that he got from a deceased donor. So I
Mm.
use, and he's a person of color. So I use him as an example. But that's the most resistance I get when people are first diagnosed with CKD, chronic kidney disease. They feel like it's the end of the world or nothing else that they can do and no need to get a transplant. So I think it could be better served if they were educated a little more and told more about what the transplant process is, why they have to go through making sure they're getting the medical clearance and the lifespan from living or deceased kidney donors.
One thing I learned is that kidney disease doesn't just attack your kidneys, it attacks your confidence. For many communities, like regardless of race, people hear your kidneys are failing and an immediate ask, right, is like, okay, am I going to die from this? Like, is it curable? Where's the medication? For many communities of color, the fear is often layered with additional challenges, limited to access to your specialists, healthy foods, transportation, financial pressures, mistrust, like she was saying, in the healthcare system, just the healthcare system in general, just not seeing you as a solvable issue, but just an issue itself. So that's why I think organizations like NKDO is amazing because that's information is what changes these kind of things and allow people to receive kidney donations like Wilson and live on and keep doing what we're doing.
I can't echo that enough, Dan. I think you hit a really good point there, is that when you're first diagnosed, not only it just patients in general typically are just inundated with information. You have the doctors telling you certain things, the nephrologist, your PCP, your nephrologist, your nurses, your techs, your dialysis clinic, all this information. Take this pamphlet, sign up for this thing, do all this. There's already a challenge with everything coming at you as you're trying to grasp this thing. And when you're looking into these underserved communities, which primarily are communities of color, now you have an extra layer, is exactly what Dan said. And when we're talking about a lot of times, what are some of the informations that we get? Oh, you got to eat right, you got to be healthy, this and that. Well, if you can't get to a grocery store because it's 10 miles away and you don't have transportation to get there, how am I supposed to have that fighting chance? And so these type of things is what are some of the barriers that a lot of these communities face. But I think primarily in the space that I'm working in, that I'm trying to get to is, first off, there's a bunch of education on survival and what you need to do to get healthy, the protocols while you're on dialysis. But realistically, is transplant really viable? When you're telling somebody that you need to get healthy, but you're looking at the wait's going to be 7 to 10 years out here where I'm at. And so when you're faced with that, do you even really want to try? Are you going to travel that 10 miles to adhere to that diet, and make that trek and spend additional time, energy, and money to feed yourself and your family when you got a fast food joint every 2, 3 blocks away? You could feed a whole family of five for $20. Like, what are you going to do? And then on top of that, it's if it's that far away, and the space that I'm working in is trying to help with living donation. And living donation, I would say, to a lot of people, especially in underserved communities, are completely far off. This is just a mythical thing. Why the heck would anybody give up a kidney for me? Give up a kidney for me? My friends, my family, nobody's gonna do this. And so we're trying to bridge that gap to show them that it is absolutely possible. And what I'm working on right now is that we are providing access to possibly to get kidney donations even before you actually get qualified. So we bypass a nephrologist so that they can get their donors can donate for voucher programs. And so this opens up the door and gives them actionable steps. And if they have that hope where they know that if they adhere, that that living donor is right there for them. And so trying to provide that hope, trying to let them see what's possible, I think is the first step. And it also depends on who's giving out this information. If you have if you have a nephrologist giving out this information to some of these folks in the communities, it's just going to go over their head. If you have Dan going in there talking to a veteran about, hey, this is the things that happen. I've seen Dan talk on some of his lives, and when he's talking to some of these veterans, they're okay. You know, you're one of us. We'll talk to you. If they're talking to Trish, and Trish says, I've been through it. I know what's going on. They're gonna take that information from Trish more so than they would some of the medical professionals. So there are a lot of layers to these barriers in these communities.
Yeah, that's really incredible insight, guys. Thank you for that. Um, Piggybacking on that, we've talked a little bit about some of the barriers when you first get a kidney disease diagnosis, but can we talk just a little bit more about what you would say are the unique barriers to a person of color who is in need of a transplant being, in the situation where they need a transplant to actually getting one? Like, what are kind of some of the major barriers that are in the
I
way?
get I'll give you one of the biggest barriers that I face and that I face in our community, right? Not just people of color, but veterans. Did you
Hmm.
know this is gonna blow y'all's mind, but a lot of people don't know this, right? Especially the people who are watching this. Veterans who need kidneys do not go through the same process as most people think. And Wilson's familiar with this as well. There are 9 veteran eligible transplant hospitals in the United States. 9.
Look
Okay.
at Dan,
There
this thing,
are
this right
1.4
here.
million veterans with CKD. 1.4 million right now, today, with CKD. There are over 25,000 veterans qualified right now, ready to get transplant. Know why they can't? Because we got 9 hospitals. There's only 9 transplant centers that the VA will allow us to go to, pay for us financially, all of the things that every other insurance would. So I would be required to have third party insurance. Well, I'm a disabled vet. Where do I go get this third party insurance from? Because like Red Cross, Red Shield's not coming knocking on my door offering me significant health insurance. So I have health coverage. Our veterans have health coverage. Our people, what we don't have is the access. It's the access. So, for instance, Wilson, you mentioned something about a voucher program. So let me dive in. You can explain a little bit more about what the voucher program is, but let me tell you how significant this could be. Okay. Emily, if you wanted to donate a kidney to me and you were like, Dan, oh my God, I want to donate a kidney to you. Your story's amazing. I'm going to go do this. Well, we may not be a biological match. There's a million different factors that make us qualified together. But you may say, you know what? I still qualify. I went to do my workups. I'm healthy. I'm great. I want to do this. Wilson gets involved. He's like, oh my God, you want to do this? Let's get you transplanted. We're going to get your kidney to somebody who needs it that does qualify. And then in exchange, we're going to turn around and we're going to get Dan his kidney, right? From the next person that his body qualifies for. That's in sense, the voucher program. Here's the caveat. Emily, you do your thing. Wilson, you go get her thing. We save a life. Now my hands are open. My Willy Wonka golden ticket. Here it comes. I get it in the mail. Now I go to cash it in. Unfortunately, the bank that I'm cashing in at does not accept these. So I cannot use this. So my journey stops. And I get in the back of the line of the 25,000 so we can get fed through the doors of the 9 hospitals. So I
And
just want you
Dan,
to understand that this process with veterans is about access. It's about access. It's about knowledge and awareness. And if we're not having the conversation like we are today, a lot of people don't understand this. So I just wanted to make sure that we not only talk about our black and brown communities, but our black and brown veterans like myself who would be trying to take advantage of these things. I live with membranous nephropathy every day. Transplant very well may be in my future. I may need Wilson to start hooking me up with microsites and all the things. I may need that. But what I'm really going to need is for the surgery to get completed. That's what
Yeah.
has to happen. The surgery's got to get completed. And in order for that to happen, I can't just be in the back of the line with my golden ticket because nobody's paying attention. So this
And
awareness is a big campaign that we're trying to solve here.
Dan, I got two questions for you on that. It's I know that we had discussions about this, and through the VA, there's a possibility with the voucher program called that community care. But tell me how possible that is.
How possible? Do you know how to
Yeah.
thread the needle of bureaucratic red tape? If you can thread that needle, okay, I spent the past 6 years navigating this with
Yeah.
the best GPS I know how to use. And I can tell you that it's very difficult. I would consider myself an expert in the navigation of the VA healthcare system, but I'm not an expert, okay? Because they move the goalpost on you. And when they move the goalpost on you and you're not paying attention, then you no longer qualify.
So
So
let's put it this way. You have 100 patients with vouchers. How often does it go through when you go through the VA community care? Let's just give whatever your thoughts are on it.
if we had a patient that had a voucher in hand, we could get
100 of
them.
them.
If we had 100 of them, we could get them through
100
community
patients.
care. We could get
Yeah,
them through
and
community care.
you could get through them through
We
community
could
care.
get EKF could get them through community care.
EKF can, but how much of that information is going out there? I mean, it's rare. It's only you're the only person I
Exactly.
see talking about this. Second question I have on this is, do you know roughly the stats of how many of these veterans, especially the ones with kidney disease or need a transplant, are people of color?
I don't know that. I don't know. I wish I did know that. I don't know that. But what I
I
can
know
tell
there's a
you,
lot.
there's a lot. It's a
Yeah,
Yeah,
lot.
based on the percentage of
right.
people of color in America and then people of color on the kidney transplant wait list, it's got to be a high percentage.
So we're
Yeah.
battling medical distrust. We're battling the medical system itself. Okay. I just got labs the other day, right? Just the other day, I was just sharing this with my wife. I got labs, and on the bottom of my EGFR labs printed out, it has in parentheses 2021.
Mm.
And the reason why it says 2021 is because I'm an African American male. And that means that calculation of my EGFR was calculated based on the non-race biased calculation. That dates back to 2021. That was medical journal. That was advocacy that got those things changed. Because before that, a black and brown person walk in, hey, 60% is your new 100.
Uh,
What? Where could I get that curve in school? I needed that in school, right? If I show up with a 60, they're like, oh, you're look, A, what? I needed that curve. That didn't exist. Listen,
yeah.
60% of 100 is not 100% in anybody's calculation. So I'm thankful that they changed it. But these are some of the small systemic things that us as black and brown folk have to put up with and have to deal with. I got to look at my EGFR number on my lab, and I have to go not only go say, hey, my EGFR is 98%, but I have to go say, hey, my EGFR is 98% of 60%? Or when was this calculated? What year was this calculated? What calculation did they use? So these things are very difficult to have to navigate as a patient. So this is why you need organization, you need foundation, you need people who have walked this walk before, you need the support. All of these things are the things that I found laying in the hospital bed, death
Yeah.
scrolling on social media, trying to find another human that had this that I could just talk to.
That wasn't 60 years ago. That was 2021. I mean, this is wild. I was having the conversation this morning. This blows my mind.
Yeah.
But back to your question, Emily. I firmly believe one of the biggest issue. I wouldn't even say it's an issue. It may be an education thing, but there is a complete huge disconnect between the patient world and the donor world. And this panel right here, this conversation that we're having right here is huge. I was on dialysis for 5.5 years. I was doing all the advocacy work, connecting with a lot of organizations, talking about awareness and all this stuff. And it wasn't until post-transplant when I was exposed to organizations like NKR and NKDO. And I remember going out to Ned's place and meeting all these donors. I was the only recipient there. I go, there's 20 donors in here. Half these folks don't even know who they donated to. Like, what? how is this even possible? As a patient, I go, how come nobody ever told me about this? And learning more and more about why people donate. And it blew my mind. And a lot of the donors at this one event where we had, I was the only recipient. There's all these donors. They were coming up to me. So what did you go through while you're on dialysis? How does it feel? Look, you donated a kidney. You don't know who like, you don't know this? Like, no, we don't. We don't even know who we donated to. And,
Mm-hmm.
we've never met them or whatever that is. And it's just, I didn't know about all the suffering that you patients go through. And I was just so blown away by this. And so one of the biggest disconnects is those two. And I think that if patients sitting on that chair understood that there's a whole not industry, but a whole just group and organizations and a whole community of people that's trying to help them, like having this webinar right now, they would be grateful, thankful, and they would know that they would give them some hope, and that's all you need to fight just a little bit more.
Yeah, the living donor community is pretty young, and it's also uniquely energized. We're not sick. We're on the other side of donation. We've already done the biggest thing we can do to, physically help somebody who's in need of,
Yeah.
physical support. And now on the other side of transplant, many of us are, really energized to, be mobilized to continue to improve people's experiences and the bigger crisis at hand. So it's a pretty unique community. Definitely one that is working hard to try and identify and solve some of the problems that exist in the space. Thank you for that, Wilson. Trish, I would love to hear from you.
Yes.
It,
Well, first of all, I learned so much from you, Dan. It's amazing behind the scenes. I must say, one of the people that my foundation helped get a kidney, one of the first, what could explain to him why he needed all of these tests. He was a vet, so he donated 2 years after I did, and he actually married me and my fiance June 6th. So
Oh,
he's doing well too. But it's amazing the process you guys go through. And to piggyback a little bit off of what Wilson said, when I'm out in the community, Emily, I'm seeing and hearing that the disconnect also comes between where the patients are not feeling comfortable with communicating with the medical staff. So when I speak and do education programs at transplant seminars, like the one we were at together in Orlando, I explained to the transplant staff, and it would be a lot easier if they could change probably some of the wording or narrative and make the patient try to ease their comfort or let them feel comfortable with speaking to the staff. A lot of them are intimidated, they're already scared. And when they don't understand things, they would just take the pamphlets and take the checklist, and they would just go with the flow. But I find, and I speak in at a lot of community events like church groups, public libraries, and that seems to be a common denominator. They don't feel comfortable or they're embarrassed to say they don't understand something. So I think that if transplant centers could communicate where to make sure their patients understand, that would help bridge the gap some, because I find that to be one of the most common things that's reported.
that's a really valuable insight.
Mm-hmm.
I also think it's not just the transplant centers though, right? Because you got to think about the patient. Remember Wilson sitting in the chair, what you don't know, right? And you're
Yeah.
relying on your social worker at the dialysis center, whether you're at DeVita or
Mm-hmm.
Fresenius, you're relying on that social worker to have your best interests at heart. I walked into some of these places all over my county. I walk right into there and I want to talk to the social workers, the patients, who's running the place. I have no business being in there. I'm not a patient, but I'm a patient advocate. And I can tell you one thing, that every single now person in my community knows my face, knows my name when we walk into these dialysis centers, because we're changing the experience, right? Providing people with the blankets or battery chargers and really paying attention to the person. How are we getting that person out of that chair? That's the question I ask. hey, social worker, yeah, we can't let you back there. The patient's real private. Da, 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 da. It's private. It's not private, right, Wilson? It's not very private.
Oh,
How many
no,
partitions did you
sitting around
have?
with
How much?
everybody.
Yeah,
No, it's no
how,
partitions.
right? I mean, I saw you wheeling a speaker, my guy. I wasn't proud. Wilson was doing karaoke at dialysis. You know what I mean? So, I mean, look, it's as private as you want it to be to a certain extent, but it's not really private. So, anyway, we want to make sure that these patients have a road, a path, right? Not just going into the world and flicking their compass and saying, hey, get off dialysis. Hey, go qualify for a living donor transplant. Well, what does that mean? How do I do that? What does that mean for me who's stuck in a chair 5 days a week, 6 hours a day? What does that mean? Right? Maybe that means I need to talk about home dialysis and maybe get there a little bit better so I can get the aggressive dialysis out of my way and start doing something a little bit easier on the body. Maybe I can get with a nutritionist and start thinking about what I'm putting in my body in the first place. Maybe I can get with somebody like Wilson or Wilson's organization that can walk me through exercise routines that are meant for people who have dialysis and ports, and we can't do pool workouts and we can't go out there and doing big curls, right? Wilson, you got fissulas in your arms sometimes. How do you want me to get ready? Ma'am, sir, is the question that a lot of people ask me is like, yo, Dan, how? And it's like, okay, well, let's get you mentorship. This is where people's life changes. And it's not the education. Flicking a compass, I can tell you what to do, right? It's not until I show you how to do it because I've been there in a way, in a sense. I've never been on dialysis, right? But I understand the fight of being sick and having to fight against your body. I mean, I had 2 strokes, 8 pulmonary embolisms, 5 at one time, collapsed lung, like had to learn to walk and talk again. I understand struggle. I understand that. Um, and that's why the importance is getting the people off the dialysis. Now, sorry, go ahead, Emily. I'll
No, that's
continue. I'll
okay.
continue a little bit. Go ahead.
No,
Oh,
Dan, just real quick, what you just sprung up on top of my head was the social workers touch these patients all the time. These social workers may or may not know this webinar is happening right now. I feel the social workers should be educated on these things to be able to guide their patients because a lot of times social work is the first line of defense. What do I do if I need this? What do I do if I need that? Well, there is a webinar that's coming up where it's advocating for you. And that's one of the things where they don't get this information unless Trish is going out there talking to them directly, meeting them at their house, or Dan, you talking to them directly, marching into the dialysis clinic. But if you didn't do that, and Trish, you didn't do that, I mean, how else would some of these patients ever get this information? We know that a lot of times the organizations that dialysis companies aren't bringing down this information all the time. We know that certainly the transplant centers aren't. It's not their job. So that's why we have a lot of work to do with reaching out to these communities.
well, on that note, I would love to hear from all of you guys. I mean, we've definitely talked about some of the systemic difficulties. We know that they are many. I would love to hear you just share some wisdom from your personal experiences and from the experiences of the people you've been working with. Um, for the people on this call who are struggling with some of the barriers we've talked about to seeking improved kidney health or transplant, what wisdom would you share with them?
Oh,
Man.
well, where to start? Dan's thinking the same thing. Said spin Trish too.
Look, where to
Uh,
start? Find me on TikTok. That's what I
yes.
tell you. Find me on
Uh,
TikTok because there's a huge, huge following, social media following, right? The first thing I needed when I was diagnosed was community. That's what I needed. And I didn't know it then, but that's what I felt. I wanted answers. I wanted medical answers to tell my doctor to give me the medicine that didn't exist. That's what I wanted. But what I needed was community. I needed to find other people that were like me in my situation that I could gather little bits and pieces from and put together my own reality. And I invite the listeners, follow us on TikTok at Enlisted Kidney Foundation. Why? TikTok is weird. It's not the news platform that everybody used to use it for. What we found in my efforts of grassroots trying to meet patients where they are was in dialysis, sitting in the chair for 6 hours a day, death scrolling on TikTok, trying to find each other. You know where they were? In a groups. they're in groups on TikTok. You can go live and then you can have like 8 panelists, similar to what we're doing now. But there's a whole chat, there's all these things. There's a community of people that we have found, hundreds of people that we have found. They're part of the community here. So one of the things that I would suggest, right, is find support. What does that look like for you? And maybe we can steer you in the right direction. Again, I don't want to flick your compass. I want to provide you some answers. So find us on TikTok. I'd love to walk you through it. Find our podcast. Let me tell you, we have a Filter Life podcast. If you want to learn a little bit of information from patients, medical professionals, organizational CEOs, researchers, if you want to hear us have conversation like we're doing today and talk a little bit about the real world aspect of this and skip some of that medical jargon, our Filter Life podcast is taken off. We're on episode 17. We got, I'm gonna tell you this right now. As of today, right now, I'm gonna log in right now, 14,000 subscribers. That means people are wanting to hear the information about this stuff. We have over 977,000 streams. We're about to hit 1 million streams on YouTube. So it's important because people are listening. So if people are listening, then we need to be talking. So I say that to invite you as a patient. You want to share your story on a platform that's getting national attention? Reach out to us, Enlisted Kidney Foundation. I'd love to highlight your story as a patient, walk you through some of this, mentor you through some of that. You don't have to be a veteran to be part of our organization. Our Filter Life community is made up of so many different people. So that would be the first thing that my recommendation is: find community.
Some of the wisdom that I think, I mean, it's multifold. Number one is advocate for yourself, and as difficult as it is, always question what you're going to have to go through. Advocate for yourself means when the doctor says take this medication, do this procedure, do that. Why? Research it. Advocate, because at the end of the day, if something is wrong, and this has happened in my experience many times, and I'm pretty sure that you, Dan, you've heard a lot of it. Trish, may have happened to you as well, where it's like, well, do I really need this at the end of the day? And you end up not needing it, because at the end of the day, if the medical professional says, "Oops," we're the ones that suffer. So advocate for yourself, number one. And to what Dan said, find yourself that community. It is available. It's not hard to find. You have NKDO, you have Enlisted Kidney Foundation, you have Trish's organization, you have a ton of organization. Don't do it alone. Do not do it alone. Find somebody to help do this with you. Also, if you can, if you have somebody that's by your side that is helping you through this process, have them help you learn, because as a dialysis patient, we're already fighting for ourselves. We're already just trying to survive. If you do have again a spouse, a child, somebody, a best friend that's willing to just come and learn with you some of these things, have them come along with you. So, it's just always advocating for yourself. Don't do it alone, and keep on learning and get yourself to that finish line.
Well said. I'm going to second everything Dan and Wilson said and just add, because I'm coming from the donor's perspective of things, my takeaway is a little bit different. I leave people with the words after debunking the myths, especially the whole driver license myths, and that probably goes more than just the people of color. I have learned that a lot of racists are scared of this as well, but I make sure they know advocating, and when I'm speaking to the communities in the different events I have, I read the room. I make sure they understand the terminology, because a lot of people don't understand what chronic kidney disease words are. They know hypertension, but they really know it as high blood pressure. And believe it or not, some people of color, they know diabetes as the sugar. So you just read the room and you make sure they know to advocate for themselves. But the biggest takeaway for me, I make sure they are aware of the stats. And at the end of my speaking engagements, for those who are unsure why kidney donation or organ donation itself in general is of importance, I ask them to close their eyes and just wonder if themselves, a loved one, whether it's a parent, a sibling, a friend, like in my case, a cousin, a relative of just anyone needed that life-changing organ to give them a better quality of life, wouldn't you want them to do it? Wouldn't you want someone to step up to plate and do it for you or for any of the loved one? And when I give them this delivery, it gives them a chance to think. And they're like, okay, you mentioned something that is of relevance because you don't really know organ donation until it affects you or a loved one. I was completely clueless. I was ignorant or not educated. I thought I had to be blood related to donate to Kimberly. When I donated, the voucher program, the paired exchange program, they were not as popular. So I too learned as I went along. So once I say this, the information is always better received because I look like them and I have literally donated a kidney myself and they see I'm doing okay 10 years later. So that's my biggest takeaway. I get them to thinking at the end.
Trish, if you could do it
Yes,
again, if it was possible to do it again, would you do it again?
absolutely. I would go around Wilson like Oprah. You get a kidney, you get a kidney. The only thing I would do differently is my urine analysis test because I'm a five timer. Those kidney donors out here who knows about it, it is pure torture. But yes, Wilson, I would do it over and over again. I wish I can do it now because in my journey to this current day, I have found so many people
Mm.
that I just want to give a kidney to
Oh my
I
goodness.
over and
Wilson,
over.
I love that question. Would you do it again? Would you donate again? Because in my line of work, I can serve my country in so many different ways. I can do this be part of something bigger than yourself in a couple different ways, right? I can be a veteran, I can serve in the military, I can do law enforcement, be a nurse, a doctor, first responder. Like it could just go on until I'm out, right? I can just live a life of service. But every single time I would choose to do that, I'm compensated for it. Hmm. Okay. So then it got me down this rabbit hole of like, okay, well, if somebody wanted to give a kidney, that's like being an angel, right? That's being a part of something way bigger than themselves. And you can only do it one time. You can only do that gift one time, and there's zero compensation offered to the person who wants to do that. What?
It's very
Come on.
common for people
Listen,
in our position to say exactly that, that they would do it again. And honestly, I think, Trish, what you're doing with your organization, that's your way of doing it again.
yep,
Uh,
Yes.
you're encouraging people to consider doing it and paying it forward by, the people that you inspire to consider doing it. Like that's you doing it again.
yep.
Um, uh,
Encouragement. That's all it takes. Is
yeah,
encouragement to get people to pull that trigger. You know what I mean?
And the reason
yeah.
why I asked this question is I work in the underserved population out here in Oakland, California, and a lot of them it's I don't want my kids to donate. I don't want my friend to donate. I love them. I don't want my family member to donate. And that is one of the biggest things. It's and having you, Trish, come out and saying that a lot of these folks they feel like if I've had people come to me. I don't. My child is young. She's 25 or he's 25. He's got a whole life ahead of him. I don't want anything to happen to him. All of these things. I don't. It's more like I don't want to take away something from them and cut their life short. But you're living proof that no, you're doing just fine. I think there is a study.
And
There's
not
no.
only just fine, but in fact, most donors would say that our lives are better on the other side of
Yes.
donation. It is a gift that the recipient gives us to allow
Yeah.
us to donate on their behalf. And if
You
we
see,
can
Emily,
express
that's
that information to the recipient, I think that more recipients would be open to allowing people to donate on their behalf.
I think there's a study that shows that living donors actually live longer than the regular folks, not because of medical purposes, but for other reasons, but just because they take care of their health a little bit more. But I mean, there is something there, and
Paying
so
attention to it. Just paying attention
yeah,
to their health.
paying
Yeah.
attention to it, and I think that if really the patient actually felt that, they wouldn't feel bad about having a relative donate.
I think so
So
too. It's work that we're really acutely interested in doing is seeing how the living donor community, which again is a very young community, we've made a lot of strides in the short period of time that we have kind of existed as a community, but we collectively feel like the more opportunities we have to interface with the patient population and express our experience and convince them of the fact that living donation is a value add to our lives and not something to be fearful of for their loved ones, that perhaps people would be more open to allowing others to donate on their behalf, and maybe make a tone shift in just our collective understanding of what donation is and what it's like for the donor. Um, yeah, I think it's super important. I've got one last question on my list here, and then I do want to leave a little bit of time for questions in the Q&A. If anyone on the call has questions for the panelists, please put them in the Q&A now, and we will get to them as soon as we get to the end of this upcoming question. But I just wanted to ask super quickly if you guys have any suggestions for everyone who is currently working to support people of color in this space. We've got a lot of living donors, a lot of advocates, a lot of medical professionals, people on this call, people who are working at business, mission aligned businesses who care about this issue, and they specifically care about marginalized people who are impacted by this situation. And what would you suggest is kind of like a major key takeaway for a suggestion that they can do to make a serious difference for people of color in this situation?
I would say listen to the patient. A lot of times, the advocates within the community, within the space, the medical community, as well as just caretakers and things like that, we go through caretaking, and we do this every single day. Or the medical community seeing patients every single day, one after another, and sometimes you become numb to it. And just remember the fact that when you're in front of the patient, this means the world to every single person that you're meeting with that day. If you're meeting with 50 people, every single one of those folks that you meet up with and you talk to has their story, and they are carrying all of this as if this is their world. So for that moment in time, I tell a lot of the medical community this is please don't rush this. Explain it to us, because this is, you may have seen it and heard it 1,000 times. This is the first time we're hearing some of this information from you. So lead with empathy, lead with compassion, and really listen to some of what these patients are going through.
So I would say one of the biggest things is be where the patients are. Meet them where they are. Stop expecting people to be where you want them to be because it's convenient for you. Because this disease is so different in every single person that you see. If they're a medical professional, they understand this. You know, they're patients. Wilson, are patients that may need living donor transplant at some point. I don't know. We can't control that. We try and do everything we possibly can to, you know, provide ourselves for a positive outcome. But you can't do anything for the patients if you're not willing to meet them where they are. So you need to be in the space of where the patients are. So if you want to help people, if you really want to help people, you really want to make change in the Black and brown communities and the veteran communities and in the minority communities, then you'll be where they are. And if you're not, you're gonna miss out. So that's my thing. Just be where they are.
And I second what the guy said. They summed it up marvelously.
Awesome. We've got a couple of questions in the Q&A. I want to try and get to as many as we can. First question is from Javier Cordero. He says, do you know of any Hispanic-oriented advocate organizations? I do not. Again, we are like a young community of living donors who are working to advocate. The medical community, obviously, that has been working on transplant has been around a little bit longer. The advocacy community is newer. So the need for different areas of support is obviously it's been identified, but the actual development of that support is ongoing. So in the event that that's something that you are interested in partnering with NKDO on, I'm happy to have a conversation with you about that. So you're welcome to reach out to me about that. I'm going to put my contact information in the live chat, and we can talk more about it. The next question is from Francisco Ramirez. He says, I don't understand why the cost considerations at the VA don't push change. It seems that the cost of dialysis is many times more than the cost of a transplant and aftercare. Um, that is an astute
Yeah.
observation. Do you
That,
want to
Podcast
respond to
right
that,
there.
Dan?
That's a whole nother podcast.
can I take that real quick? So that no, that is true. That is true. But I want you to peel the onion back just a little bit, right? Because the cost of dialysis is just the surface. Okay. The cost of dialysis is just the surface. The cost of transplant, we have 9 transplant hospitals. You got to pay the surgeons, the hospitals, all the surgery equipment, all the OR, all the thing. It is a multi-million-dollar transplant organization within those 9 hospitals. So let's talk about how we can get rid of that out of the VA budget because we don't even need it, right? We don't need that budget because what we can do is take community care and get our veterans transplanted with like I know NKR got like partnerships with over 100 some hospitals. Boom, problem solved. But so I think we need to pull the onion back a little bit more and pay more attention to like, look what we could save, multi-millions, right? Multi-millions. Then we wouldn't have the backup of veterans in the first place. And then, yes, let's address the reason why veterans are getting kidney disease more often than the regular population in the first place, right? 1 in 7 US Americans that are walking around today have kidney disease. 90% of those people don't know it, okay? 90% of them don't know it. Let me tell you that 1 in 6 veterans have kidney disease. 1 in 6 veterans are walking around with active kidney disease today. So, dialysis is needed because it's really the first line of defense, but we really need to change the medical thinking. We need to not get to dialysis in the first place. We need early detection. We need to catch these things way before they get out of
Mhm.
control.
Thank you for that. Mark McIntosh mentions in the chat, this is an awesome conversation. Drive for Five's focus is educating communities of color about everything you're expertly discussing. Would love to connect with each of you and share more why serving communities of color has become a calling. I received a kidney transplant 2 years ago. So Mark McIntosh, if you guys do not already know him, you can find him or Drive for Five. And I'm happy to get you connected with him after the call.
Can you
Um,
connect me to him after the call?
absolutely. Yep,
Mark's a
Thank you.
happy to.
legend. Mark, you're a legend.
Well, you know
See him
our
all.
email address, ekf@filterlife.org. Everybody can reach out there and we'll make sure everybody gets taken care of. And the person who was asking about a Spanish or a Spanish heritage organization, please
Yeah,
reach out
please
to
chime
us
in.
because we have some organizations that we work with that we can get you connected with depending on what your need is in that particular realm. So please reach out to us for sure.
Awesome. Those are all of the questions in the chat, and we've got 1 minute left. I just want to super quickly thank everybody so much for being here. We want to once again thank Sanofi for their generous support of this webinar series. We'd like to invite everyone to the final session in this year's webinar series, which is an Ask Me Anything interactive style event on the topic of resources for kidney patients. Super pertinent to what we've been talking about today. We're going to be inviting people from a bunch of different entities and organizations that provide support and resources for kidney patients who are seeking a living donor. So RSVP to attend that by heading to the link that I'm putting in the chat right now. And we also want to ask those of you in attendance to take a quick moment to complete a super brief survey that will help us as we seek to continue to provide high quality educational opportunities for our members and the wider kidney transplant community. The link for that survey is in the chat here as well. We are right at the hour. Thank you again so much to our panelists. Really happy that you guys were able to make it and join us today. Thank you to everybody who is in attendance. And I hope everybody has a wonderful rest of their day and a wonderful rest of their month.
Thank you so much
We'll
for
All
see
right.
you.
having
Thank
Dan, I'm
us.
gonna holler
you.
at you tomorrow, Dan.
Yes, sir. I'll talk to you soon, sir.
Thank
Bye.
You
you
too,
all.
Trish.
Trish,
All right.
nice
Talk
seeing
to
you.
you.
Emily.
Thank
Nice
you,
seeing you
Emily.
both again.
Amazing.
Bye,
All
guys.
right, we'll
Amazing.
talk soon.